Hello and welcome to my presentation, Vision Balance System, Seeing the Light Again, a new hope for retinal health, 5 keys to saving your vision. Who is this for? This masterclass is for you if you or someone you love is living with macular degeneration, dry or wet, retinitis pigmentosa, diabetic retinopathy, retinal or optic nerve damage due to vascular issues like eye stroke, retinal vein or artery occlusion, non-arteritic anterior ischemic optic neuropathy. Whether you are facing vision loss yourself or want to support someone close to you, this is a space of hope, healing, and empowerment. You are not alone, and this is not the end of your story. Whether you are seeking answers, hope, or new possibilities, you are in the right place. Together, we will explore a path toward clarity, confidence, and a fuller life. What you will discover in this masterclass: the number one lie traditional medicine tells about retinal disease. If you have been told there is nothing you can do about degenerative or vascular retinal conditions, that you should just wait and manage the decline, it's time to question that. Today we challenge that belief, because there is something you can do. That belief is not the whole truth. You will discover how to prevent further vision loss without relying solely on injections or medications. Medications and injections often don't address the root cause and may come with side effects. But real healing starts when we support the body and eyes from the inside out, naturally, gently, and holistically. You will learn about the 4 essential pillars of eye health, 4 core elements that create a strong foundation for retinal recovery and resilience. These pillars can help slow, stop, and in some cases even reverse the effects of degenerative and vascular eye conditions. In the next 60 minutes or less, you will discover how to activate your body's natural regeneration and protection mechanisms. Your body is not broken. It's built to heal when given the right signals. You will learn how to support your eyes in doing exactly that. The hidden causes of vision loss that your doctor might not be telling you. We'll explore the deeper root causes of macular degeneration, retinitis pigmentosa, diabetic retinopathy, and other retinal conditions, even if you never heard this in a clinic before. The simple lifestyle hack that could sharpen your vision in days, not months. It's natural, safe, and surprisingly easy to implement, and it might just become your favorite daily ritual. An eye-opening, step-by-step roadmap to healing your retina. Think about it. Does it sound like you? Have you been diagnosed with macular degeneration, retinitis pigmentosa, diabetic retinopathy, or optic nerve stroke, and told it will only get worse over time? Do you worry how much longer you will be able to read, drive, or recognize the faces you love? Do you lie awake at night thinking, there must be something I can do to protect my vision, but no one's telling me what it is? If you have asked yourself these questions, you are not alone, and you are in the right place. Do you feel frustrated imagining the parts of life you might miss? the colors, the faces, the freedom, because your vision is slipping away? Have you silently given up, believing that blindness is inevitable, that there is nothing left to do but wait? Do you carry guilt, wondering if you did something wrong, and wish you could go back and change the choices that brought you here? If so, it's not too late. There is a path forward, a path that supports your eyes, your health, and your peace of mind. Do you feel like you are doomed, sentenced to a life with little or no vision, no matter what you do? Is it hard to imagine a future where you are not constantly battling the fear of losing more sight each day? It's time to break free from these feelings. Today we will uncover how to take back control, restore hope, and protect your vision for brighter tomorrow. What if everything you have been told about your vision loss is incomplete? And the real problem is not your eyes. The real problem is that you haven't discovered the 5 keys to complete eye health that medical professionals aren't talking about. Imagine what life would be like if you wake up each day free from fear, no longer haunted by the thoughts of losing your vision. You feel confident and in control, knowing you have a clear plan to protect and support your eyesight. You are empowered, equipped with practical steps you can take each week to nourish your eyes and preserve the vision you have, and possibly even improve it. Your new reality is within reach. You will no longer live with the sinking feeling that you are missing out on life because of fading vision. You are finally feel in control, equipped with the knowledge of what your body truly needs to heal and protect your eyesight. No longer in the mercy of doctors or waiting on the next research breakthrough. You will take your eye health into your own hands with clarity and confidence. The one thing you need to know: there are just 5 powerful, simple keys that can help you manage and even begin to heal your macular degeneration, retinitis pigmentosa, diabetic retinopathy, or vascular disorders. And here is the best part: you are not powerless. You can take control. You can start today. In the next part of this masterclass, I will walk you through each of these 5 keys step by step, so you know exactly what to do and how to start seeing results. Who am I to make these claims? I'm Dr. Vadim Dekhtyar, and my journey is anything but conventional. After graduating as a medical doctor in 1990 from Kaunas Medical Academy in Lithuania, I chose a different path than most Western physicians. Instead of limiting myself to pharmaceutical solutions, I pursued certifications in acupuncture in 1991, embracing ancient Eastern healing wisdom that has stood the test of more than 4,000 years. After we moved to the United States, I expanded my expertise even further, earning a Doctor of Acupuncture and Chinese Medicine degree from both the Midwest College of Oriental Medicine in Chicago and the Pacific College of the Health and Science in San Diego. Why does this matter to you? Because I bridge the gap between Western diagnostics and Eastern healing traditions, giving you access to solutions most eye doctors have never even considered. That's exactly why we created Life Balance Clinic located in Glenview, Illinois, a place where true healing begins. At Life Balance Clinic, we believe that preserving and restoring vision requires more than just managing symptoms. We combine the ancient wisdom of traditional Chinese medicine, which has supported eye health for thousands of years, with the latest advances in modern technology to create a comprehensive, personalized approach. Our goal is to help you activate your body's natural healing systems, protect your eyesight, and reclaim your quality of life naturally and effectively. So, and now the 5 keys to reclaiming your vision. Over the years, I've worked with many people facing degenerative or vascular retinal conditions like macular degeneration, retinitis pigmentosa, diabetic retinopathy, and retinal vascular blockages. And what I have seen is truly inspiring. 80 to 90% of my patients who consistently applied these 5 keys were able to stabilize or even improve their vision. These aren't complicated. They are natural, science-based, and practical, and I'm about to guide you through every one of them. These 5 keys form the foundation of the vision balance system, a step-by-step approach to supporting and protecting your vision for years to come. And the key number 1, very important, understanding the real cause of vision loss. What really causes vision-threatening retinal conditions? It's not just bad luck or genetics. While some people have a genetic predisposition, especially when we are talking about condition like retinitis pigmentosa, most cases of degenerative and vascular retinal disorders are influenced by multiple modifiable factors. And the official picture of the World Health Organization and the CDC is that over 90% of vision loss from, for example, diabetic retinopathy is preventable with early detection and proper care. Lifestyle-related chronic diseases, again, like diabetes, high blood pressure, and high cholesterol are strongly linked to retinal damage. Inflammation and oxidative stress play a key role in macular degeneration and retinal vascular damage. The hidden everyday causes that add up over time: poor nutrition, highly processed foods, high sugar intake, and lack of key nutrients like lutein, zeaxanthin, omega-3s rob the eyes of what they need to thrive. Toxic environment, pollution, blue light exposure, and chronic stress increase oxidative damage and accelerate aging in retinal cells. Lack of movement, a sedentary lifestyle, slow circulation, and your retina depends on good blood flow and oxygen delivery to stay healthy. Medication side effects. Many common drugs for blood pressure, cholesterol, or autoimmune diseases have long-term side effects on eye health. Systemic inflammation or chronic illnesses. Chronic conditions like diabetes, cardiovascular diseases, metabolic syndrome, and autoimmune disorders contribute to retinal damage through inflammation, poor circulation, and nerve degeneration. Yes, it's a perfect storm, but it's not a life sentence. When all these factors pile up, the retina suffers. But here is the good news. If lifestyle helped create the problem, it can also help become part of the solution. So let's discuss, for example, the cause of macular degeneration. The website of Mayo Clinic states no one knows exactly what causes dry macular degeneration. But I recommend to read the book Ancestral Dietary Strategy to Prevent and Treat Macular Degeneration by ophthalmologist Chris Knopp, MD. In his book, Dr. Knopp argues that macular degeneration is not an inevitable consequence of aging or genetics, but rather a modern disease driven by the widespread consumption of processed, nutrient-deficient, and artificial foods. He contends that the shift away from traditional whole food diets, what he calls ancestral diets, toward Western diet, which is containing high levels of saturated and trans fats and added sugars, processed foods, is the primary cause of the dramatic rise in age-related macular degeneration and other chronic diseases. The book calls for a paradigm shift in both public health policy and personal dietary choices, urging a move back to nutrient-rich, minimally processed foods to combat macular degeneration and related chronic diseases. While modern Western medicine has only been with us for around 300 years, traditional Chinese medicine has been refining its understanding of eye health for over 4,000 years. According to this time-tested wisdom, conditions like macular degeneration, retinitis pigmentosa, diabetic retinopathy are not random. They arise from deeper imbalances in the body. Traditional Chinese medicine identifies three core causes of retinal decline. Number one, restricted blood flow to the eyes. The eye is a delicate organ that depends on a steady, rich blood supply. Poor circulation means less oxygen and fewer nutrients reach the retina, and healing becomes impossible. Number two, internal inflammation and heat accumulation. Inflammation isn't just buzzword. In traditional Chinese medicine, it's seen as a heat or excess fire that damages the sensitive tissues of the macular and optic nerve, accelerating vision loss. And number three, weak or congested what's called liver function. The liver is believed to open into eyes in traditional Chinese medicine. When it's overburdened by toxins, processed foods, stress, or medications, it can't filter oxidative waste effectively. The result? Increased eye strain, blurry vision, and faster degeneration. And modern medicine confirms this theory. Today, we understand that as waste materials like drusen, deposits of cholesterol, calcium, and cellular debris build up behind the retina, they act like a slow poison. They block blood flow to the macula, they trigger chronic inflammation, they starve retinal cells of nutrients and oxygen. Over time, this leads to irreversible damage unless we step in early with the right approach. The root causes of macular degeneration mirror cardiovascular disease. The only difference, the symptoms appear in your eyes instead of your heart. If you do nothing to increase blood flow, control inflammation, and break down these waste products, vision loss will progress as these cells continue to starve and suffocate. The key number two, why following the norm is failing you. And I want to start with a quote of Mark Twain. Whenever you find yourself on the side of the majority, it's time to pause and reflect. Let's get honest about why you are not already doing what's necessary to protect your eyesight. It usually comes down to two things. First, you have been convinced it's impossible. And number two, you know or you believe it's possible, but you have no idea where to start. Sounds familiar? And who can blame you? You have probably heard the same tired script from conventional doctors. There is no cure for this. You have to learn to live with it. Try to enjoy your vision while it lasts. It sounds compassionate, it feels definitive, but let me ask you, is that working for you? Are you truly okay with passively watching your vision slip away because no one gave you permission to believe something else is possible? Here is the uncomfortable truth. It doesn't matter how many credentials your doctor has or how impressive the clinic looks, whether it's the world-renowned specialist or a brand new graduate. They are often offering the same thing, a roadmap to managed decline, not recovery. And if your only path is a slow slide into darkness without any alternative, is that really a choice at all? If you want different results, you need a different approach. Real progress begins with a single decision. Stop waiting for permission to believe in your potential to heal. You don't have to accept decline as an inevitable. You don't have to live inside someone else's limitations. And the first step, let go of the belief that you are doomed. Hope isn't naive, it's strategic. And it just might be your most powerful tool. There is a testimonial of one of my patients. I saw a retinal specialist at the very beginning of my treatments with Dr. Vadim, and again 2 days after my last treatment with Dr. Vadim. The retina doctor said the wet macular degeneration in my left eye was stable and holding, so I don't need eye injections. Additionally, the dry macular degeneration in my right eye was in great condition. Thank you so very much, Dr. Vadim. Key number 3, the eye health lifestyle revolution. Let's be blunt. The truth is most doctors aren't trained to prevent diseases. They are trained to manage it. And I can say this from my personal experience. As a medical doctor myself, I can confirm that the majority of conventional eye specialists are highly skilled at diagnosing and treating symptoms, but they receive no training in areas like nutrition and how it affects eye health, lifestyle modifications that can support healing, holistic approaches to preserve or restore vision. They are, after all, called medical doctors for a reason. Their education is centered around using medications, injections, and surgeries to control disease symptoms, not necessarily to prevent, reverse, or optimize health naturally. And here is a startling fact. According to research published on PubMed, prescribed medications are the third leading cause of death in the United States. But the exciting news is you now have access to the knowledge and tools that go beyond disease management and move toward true healing and vision protection. Despite their good intentions, many doctors are caught in an outdated model of care that over relies on drugs, devices, and surgeries and underestimates the healing potential of your own body, especially when it's properly supported through diet, mindset, and daily habits. So there are like two models. The old medical model, which we can call cross your fingers medicine. We hope it's gonna work. We hope you will get better. And this model tells you basically eat whatever you want, because no one told you food affects your eyes. Go to the doctor only when things start to go wrong. Get poked, scanned, and tested repeatedly. Take a mix of medications, each with its own side effects. Accept invasive procedures like eye injections as the only hope. Watch your eyesight slowly fade. Learn to adapt and make do with limited vision. Carry quiet grief for the future you once imagined for yourself. And the different approach, the eye health lifestyle revolution. There is a radical new approach, and it's not about magic pills or fringe ideas. It's grounded in empowering science-backed choices that put you in the center of your healing. This model involves eating in a way that actively supports your eyes and reduces inflammation, using movement to nourish your retina and optic nerves, managing stress to lower eye pressure and promote cellular repair, strengthening neuroplasticity and visual function with targeted practices, learning how light, sleep, and even posture affect your vision. The new way, the 4 pillars to complete eye health. Number 1, nourish your eyes from within. Number 2, restore healthy blood flow to the retina. Number 3, reduce systemic inflammation and oxidative stress. And number 4, activate your body's natural healing pathways. And let's go one by one of each of these pillars. So number 1, nourish your eyes from within. The retina is one of the most metabolically active tissues in the body. It needs very specific nutrients like lutein, zeaxanthin, omega-3s, vitamins A, C, E to function and heal. What this pillar includes: anti-inflammatory, antioxidant-rich diet, targeted eye supportive supplements, blood sugar and cholesterol management through food. Number 2, restore healthy blood flow to the retina. Poor circulation is a major contributor to retinal degeneration and vascular conditions. Improving blood flow means more oxygen, nutrients, and healing potential for the retina. What this includes: gentle physical activity, acupuncture and microcirculation therapies, managing blood pressure and vascular health. Number 3, reduce systemic inflammation and oxidative stress. Chronic inflammation and oxidative damage silently erode retinal cells over time. Reducing these internal stressors can halt and sometimes reverse progression. What this includes: anti-inflammatory lifestyle changes, stress reduction practices, natural antioxidants, and detox support. Number 4, activate your body's natural healing pathways. Your body has built-in repair systems, but they are often blocked by modern lifestyle factors. Activating them brings new hope for regeneration. What this pillar includes: light therapies like photobiomodulation, sleep hygiene and melatonin regulation, mind-body connection, and nervous system balance. So at this point, you have learned some critical truth. We know that the main causes of macular degeneration and other degenerative and vascular retinal conditions are not random, but connected to blood flow, inflammation, and lifestyle factors. We understand that waiting for new medications or surgical miracles is not a strategy. We must become our own advocates, proactively supporting your vision every day. We recognize the importance of living by the 4 pillars of eye health, a lifestyle designed to nourish, protect, and restore the eyes naturally. And now it's time to take the next step. In the next few minutes, I'm going to reveal the final set of keys, the powerful actions that have the biggest impact on saving and improving your sight. Even better, these steps are safe, natural, and free of harmful side effects because they work with your body's own healing systems, not against them. The key number 4, acupuncture and the vision balance system. What if your eyes could heal, not just be managed? And that the foundational belief behind ophthalmic acupuncture, a specialized form of treatment that's quietly revolutionizing how we support vision health. Unlike general acupuncture, which focuses on body balance, ophthalmic acupuncture is precision targeted to the neurological and vascular systems connected to the eyes, and the results can be remarkable. How it works? Just like traditional acupuncture, this method works by stimulating key points that regulate the body's cellular and tissue functions. But what makes ophthalmic acupuncture unique is its ability to increase blood flow to the retina and optic nerve, enhance oxygen and nutrient delivery to delicate eye tissues, support detoxification, and reduce local inflammation. It's activate nerve signaling and promote cellular regeneration. And this isn't theory, it's practiced, tested, and evolving. And one of the pioneers of this breakthrough approach is John Boel, a Danish acupuncturist whose work has transformed the field of vision recovery. He developed a groundbreaking protocol specifically for treating degenerative eye conditions like macular degeneration, retinitis pigmentosa, diabetic retinopathy, glaucoma, optic nerve atrophy, and other conditions related to retinal damage. His system, known internationally as Acunova, is now being taught and practiced worldwide by select clinicians trained directly by him. And I was fortunate enough, I was honored to receive direct training from Dr. Boel, learning this rare method firsthand from its originator. This means patients are not just receiving generalized care, but the authentic and complete version of this advanced system implemented with the precision and understanding it demands. Another testimonial from my patient. For the first time in my life, I had difficulties completing the required vision test when I was renewing my driver's license. My eye doctor told me that there was no treatment for this condition, only an observation. I wasn't ready to give up driving, which is why I was thrilled when I heard a segment on the radio about an alternative way to improve vision for people with macular degeneration. I called the office and scheduled an appointment. Dr. Vadim explained the procedure to me in great detail, and we started acupuncture treatments. I was impressed by the positive atmosphere, service, and it wasn't painful. I especially liked the eye massage treatment with the special glasses. I have noticed that my vision has gotten better throughout the treatment course. I'm grateful to Dr. Vadim and his staff. And I know after this treatment course, he completed his vision test and successfully renewed his driver license. The vision balance system integration is the future. This acupuncture-based protocol is part of what we call the vision balance system, a holistic model that combines ancient principles with modern neuroscience, lifestyle interventions, and functional vision therapy. It's not about replacing your current care. It's about enhancing it. And it's very important for you to understand. It's not about replacing your ophthalmologist. You are coming to see us from your ophthalmologist. You are going back to your ophthalmologist after treatment with us. If you are ready to go beyond passive management and into active restoration, this could be your next step. And finally, key number 5, partner with an experienced professional for lasting result. Healing your vision isn't something you have to do alone. In fact, one of the most powerful investments you can make is to work with a professional who deeply understands the complexity of degenerative and vascular retinal conditions and who is committed to helping you thrive. An experienced practitioner brings you more than just guidance. They bring innovative science-backed treatment strategies. Ongoing support and accountability is also important to keep you on track. Holistic care that integrates your physical, emotional, and lifestyle needs. Think of it like this. You wouldn't try to navigate a maze blindfolded. You would want someone who knows the way. That's the power of the right guide. By simply attending this masterclass, you have already taken a powerful first step. You have opened the door to possibility. But now let me introduce you to the next level, the vision balance system, a truly integrative program designed to not just manage vision loss, but to actively support your eyes in healing and renewal. This is not a one-size-fits-all solution. It's a carefully designed, evidence-informed, and personalized roadmap to visual wellness. Every component is chosen to target the root causes of visual decline while strengthening your body's natural capacity to repair and regenerate. What makes the vision balance system unique? This system blends the best of Eastern and Western approaches, combining advanced diagnostic tools, modern technologies, and time-tested healing practices to create a truly holistic approach to eye health. And what this system includes. Number 1, comprehensive testing and personalized assessment, which includes, we begin with a full spectrum evaluation of your current vision health. Visual acuity test measures sharpness of your central vision. Gross peripheral vision test shows us your visual field. Amsler eye grid test detects early signs of macular distortion. The unique echograph meridian analysis, a cutting-edge diagnostic system based on traditional Chinese medicine that maps your body's energy channels to identify blockages and imbalances related to your eyes and overall health. These assessments help us create a treatment plan that's uniquely tailored to you. Number 2, dietary and nutritional consulting. You will receive individualized guidance on foods that support retinal health and reduce inflammation, targeted supplements backed by clinical research, eliminating dietary triggers that may silently damage your eyesight. Nutrition isn't just fuel, it's medicine for your eyes. Number 3, functional vision therapy and eye exercises. A series of easy, effective, at-home eye exercises designed to straighten ocular muscles, improve focus and convergence, boost neuroplasticity to retrain your visual system. These are simply daily actions that yield lasting improvements. Number 4, the core of the program, 10-day ophthalmic acupuncture intensive. This is the heart of our program. You will receive 3 acupuncture sessions per day using specialized protocols developed by world-renowned expert John Boel. This acupuncture protocol enhances blood flow, oxygen delivery, and nerve signaling to the eyes, addresses root causes of visual degeneration, not just symptoms. Administered by a practitioner directly trained by Dr. Boel himself. This treatment alone sets our program apart. Another testimonial from my patient. The treatment I got was a very intensive course lasting about a month. It wasn't, it was probably three weeks. But about halfway into it, I was beginning to notice a slight overall improvement and was anxious to follow up on it during the next appointment with my retinal specialist. And indeed, the exam confirmed that my condition was stable, not requiring injections, and showing a slight improvement in vision. If I had known a year ago, perhaps the formation of the black hole could have been delayed. Thank you, Dr. Vadim, and I will be seeing you again for the next installment. Part 5 of the system, the eye electrostimulation therapy. Gentle electrical impulses are used to activate underperforming neural pathways, improve retinal sensitivity, support cellular repair and regeneration. Think of it as a physical therapy for your vision. Number 6, photobiomodulation, red light therapy. Using safe, non-invasive red and near-infrared light, this therapy stimulates mitochondrial energy in retinal cells, promotes healing of the optic nerve, reduces inflammation, and supports long-term cellular vitality. Number 7, targeted supplementation protocol. Based on your test results, we recommend clinically effective nutrients like lutein, zeaxanthin, astaxanthin, omega-3s, vitamin D, everything your body may need. High-grade supplements chosen for purity, potency, and bioavailability. This works synergistically with all the other components of the system. The result, a program designed not only to slow down vision loss, but to help you recover function, rebuild confidence, and reclaim your independence. And you are not just a patient, you are a partner in your own healing. Your roadmap to healing your eyes, starting with understanding why your eye health is deteriorating, following a comprehensive treatment plan, living the eye health lifestyle, implementing integrative ophthalmology and acupuncture, investing in an experienced professional who has your best interests at heart. These 5 shifts alone are enough to sustain and potentially rebuild your eye health for a lifetime. Would you like to get a personal consultation? Contact us today.